my name is Amanda. I'm going to talk to you a little bit about diabetes today and what I've learned from researching it over the last few days. I do work at the hospital and I do work with diabetes patients every day I go to work. So I have had a lot of experience with patients that suffer from this illness, but it was nice to learn a few more facts about it and really kind of get a breakdown of what it is and go a little bit further in detail with it because, with my job, we go and we check a blood sugar and we treat it and we move on, but we really don't get very much into it. We do see a lot of the symptoms, but it was nice to just kind of get a better breakdown of how people are treating it and then also look into a lot more of the mental effects because, we do get into routines at work and we may not always think about, the different levels of it, if that makes sense. Just to get started, for those of you that don't know, diabetes is a disease in which the body is unable to properly use and store glucose. Glucose is a type of sugar. Glucose can back up in the bloodstream and cause our blood sugars to raise, and it can cause just a whole long list of symptoms, and I'll go over those in a minute, or a few of those in a minute. Insulin is a hormone that enables the body to use glucose found in food for energy. There are two types of diabetes. Well, three, but the two main types of diabetes are type 1. Type 1 is when the body completely stops producing insulin, and these people are dependent on insulin injections. They need them to survive every day. Type 2, which was formerly called adult onset diabetes or non-insulin dependent diabetes, is when the body just doesn't produce enough insulin or is unable to use the insulin they have in a proper way. Type 2 diabetes can be managed with oral agents if needed. If not needed, it can be managed with a proper diet plan and exercise plan. Type 1 diabetes is more prominent in young adults and children, but it can be found at any age. Type 2 is usually or more prominent in people overweight, over 40, and with a family history or close relatives with diabetes. I have a list of symptoms. I'm going to read off a few to you, but being very thirsty, frequent urination, increased hunger, blurry vision, irritability, numbness in the hands or feet. That's also called neuropathy. Unexplained fatigue, wounds that don't heal, frequent skin irritation, bladder infections, and gum infections. And that's just a small part of the list there, so it can go so much deeper than that. Anyone can get diabetes. People with close relatives are more likely to get it. It can cause a lot of fatigue, cause a lot of other symptoms, high blood pressure, strokes, physical inactivity, and it's growing. It's growing in our children. We're seeing way more cases of diabetes in children, and I found that really interesting because, you just don't think of children to have these things, but it is very common, and we should be doing a lot. We should be doing a lot with our kids' diets, I think, and I just found that really interesting. There is also a type of diabetes called gestational diabetes. It's found in pregnant women, and people that develop gestational diabetes during their pregnancy are more likely to develop full-blown diabetes later on in life, and I did find that interesting. It has a major effect on your mental and emotional state. It is something that you have to think about every single day. You have to be on a schedule with checking your blood sugar. You have to be on always aware, and I'm lucky to not have to do this, but you have to always be aware of what you're eating and the amount of exercise you're getting. And it is something that can be debilitating to your mental state, not only your physical state, but your mental state. Your social terms, it it has a major influence on your family and the way you live, your friends. I think everyone should be involved. Your family should know about your illness. Your friends should know about your illness. Everyone should know so they can help you take better care of yourself. And I think that, getting everybody involved is a major part of being successful with treating this disease. You have to have to kind of move and live a normal life. You have to have a great meal plan. You have to be physically active, and you do need to surround yourself with people that can do that with you and encourage you. And, also if something goes wrong, you need to know about that. So your communication with your family and friends is one of the key factors in being successful with dealing with this illness. You have to have a great communication level with your doctors, with your nurses. You need to be educated by your doctors. You need to be educated by your nurses. People with diabetes should see their endocrinologist at least once every 6 months, and you should have a good relationship with them and be able to discuss it and ask questions, because this is a disease that can truly it is so debilitating for a lot of people, but you don't have to let it define you. You just need to be motivated to move forward and to just say, I'm going to live my life the way I want to, and I want to be healthy. You have to be compliant. You have to, just really work for this every day. And so many people take their health for granted. We can go and eat all the candy we want and all that. And there are these people that just cannot do this. And so I found all of these facts just really interesting. Especially, it really stuck out to me that it's recommended by the American Diabetes Association to see your doctor once every 6 months, to see your endocrinologist and keep a close relationship with them. And I think that's great. I think in this class, we talk a lot about patient-doctor communication. This is a disease where that is extremely important. I took a lot away from researching this, especially dealing with patients that have diabetes all the time, and it just really took it into a deeper level and helped me learn a little bit more about, you just think that it's just about regulating blood sugar, but it really does affect their every move, every day, what they eat, what they do, just everything. And so I think I'll take that away from this, and I'll really look at it a lot differently. There were just hundreds of thousands of websites on diabetes, and so I could go on and into further detail about it, but I just wanted to cover the base work, give you a little bit of information about what it was so you have a better understanding, tell you some of the symptoms, tell you what I thought was important about having a good, family and friend, like having your family and friends involved, having a good relationship with your physician. I hope you took a little bit away from this and learned a little bit about diabetes. I know I did. And I really enjoyed it, and I will probably continue to research it because I found it extremely interesting. Thank you for your time. I hope you guys learned a little bit, and I'll see you next time.